Nice Tribe, and welcome to today's Anju Asks with Dr. Jonathan Lee of the Aesthetic Studio. And today we're going to be talking about liposuction versus fat freezing. And Dr. Jonathan Lee, hi.
Hello.
Today.
Thank you for coming around again.
Can you just tell us a brief outline of what is liposuction, first of all? Am I saying it right?
Liposuction. Yes, absolutely
right.
Liposuction. So liposuction and some of these other topics you want to talk about today, the fat freezing, these are essentially methods to sculpt a more attractive, healthier, younger looking silhouette of the body, and sometimes we also use it for facial areas. So the liposuction is essentially a minor surgical procedure. It can be a fairly big surgical procedure as well, depending on the number of areas you want to cover in a single session. But the idea would be to extract the fat using one of these or something similar to this little cannulas, which are blunt tipped metal tubes with holes at the end, and a suction device at the other end to suck out fat. And there it's almost like a sculpting tool. So we remove fat in areas where they might be excessive, and then in so doing carve out a nicer looking silhouette or shape. And we have them in different sizes, in different lengths. This is obviously not a new technology. This is has been used for many years with pretty good effect, but bearing in mind that it is still a surgical procedure. Right. However, there is a spectrum of the way that it may be done. So it's done sometimes in certain countries by dermatologists under local anesthesia, and they would do small areas at a time and stage them in multiple sessions. Or they can sometimes be done, often the plastic surgeons like to do bigger procedures, and they might be doing multiple areas and removing larger amounts of fat in a single session. And so the risks and the downsides of the surgical approach is often related to the amount of time the patient spends under anesthesia, also the amount of fat that's being extracted in a single session. There's also an certain associated blood loss related to that. The more fat you extract in a single session, the more potential for blood loss, the more potential for fluid shifts in the body, and potentially the need for overnight stay, hospitalization. So the planning can vary depending on the surgeon's preference, the patient's needs, the patient's requirements to have everything done in a single session, or whether they're willing to stage it out in multiple sessions. So those are technologies that, those are surgical approaches that have been used for many years, and there's obviously textbooks written about the different approaches and to tackle these different conflicting issues about downtime, safety, blood loss, and also contour irregularities and so on. Like, how do we correct some of those if it's over-suctioned, or if we need to go back and do it again? So it's, in general, because it's a surgical procedure, it's not something that we can go back and touch up too often, because there's trauma, there's scarring, and so on. So it's something that you would do, and then you would not touch the same area again for many months, 6 months at least, sometimes up to a year. But it is generally a very enduring procedure. So if it's done properly, in proper hands, the change in shape and the silhouette can be fairly permanently changed in a very attractive way.
So it's kind of a bigger deal. It's
a bigger deal in general, conceptually, because it's a surgical procedure. And there's associated downtime. So, you know, if you're somebody who has to exercise every 2 days, having a liposuction procedure might set you back 2 weeks, for example. Even in a sort of minor in-clinic local anesthetic type situation that the dermatologists do it, I think generally you would not be able to exercise that area
Yes.
for up to 2 to 3 weeks.
Yeah, so it might be relevant for somebody who has a bit of a bigger vision in mind in terms of how they want to change
Yes.
their appearance.
Yes.
Is that right?
So we're often comparing procedure for procedure, but really we should be thinking about what the patient desires in terms of their lifestyle, also the degree of change that
Yes.
they're desiring.
Yeah.
Is it a big change? Is it a small change? Are they willing to accept smaller incremental changes in the silhouette over multiple visits without any downtime? And so that's where we now have developed this concept of a non-surgical approach, and over the last decade or so there have been significant advances in this area, non-surgical, no incisions required, no blood loss, minimal risk, and we're using technologies such as fat freezing or heating the fat, like radiofrequency technologies, to selectively treat certain areas and reduce the volume of fat. These obviously, the two or three most common ones are cryolipolysis, so fat freezing, and there's different brands that take on this approach. And then there's also ultrasonic cavitation, where they're pounding the fat with external ultrasound, radiofrequency, and so on can also help to reduce fat. And each of these non-surgical technologies have their pros and cons in terms of their effectiveness, their comfort level, their reduction, the amount of reduction that can actually be achieved with these. But I think that we now actually have a very reasonably effective selection of devices that we can use to offer patients who don't want surgery or who don't want the downtimes, or perhaps are not willing to accept any of the risks involved with even minor surgical procedures, to have slower but incremental improvements to their silhouette. Because I used to do liposuction in the past, and I actually do less and less these days because of these technologies, I still assess the patient the way I would with a liposuction.
Okay.
So the wonderful thing about, and what I think a lot of patients, sorry, the mic dropped. What a lot of patients see but maybe don't appreciate, because we need to point it out to them, is the way the body changes with age. It's not just weight gain, but also the distribution of that fat that's gained and the way it changes the body. So even for a female silhouette, we know that the waist to hip ratio is quite important, and the mind is already set to know what a younger silhouette looks like, and the kind of body that is associated with somebody who is a little bit older. And we know that in looking from the front, a patient would put on fat here around the love handles and around the the hips and saddlebags and the inner thighs. So there are specific areas where fat is put on more so than other areas, and that changes the body shape. So when we're talking about these liposuction or non-surgical body contouring devices, we're talking about really selectively spot treating certain areas to recreate that very attractive, younger, youthful, fitter, healthier silhouette.
So tell me about fat freezing and how you can target those areas specifically, because I see you have
right. So again, as I was saying, when we do this assessment, if we were to do liposuction, generally we know, for example, that the bulge, like if a patient comes in and says they have a muffin top, and there's a mum tum, a little bit of excess fat and loose skin that tends to billow over the top of your pants, for example. And when we actually pinch them, you notice that the skin here is thinner than the skin here. It tends to be thicker around the umbilicus around the umbilicus in this kind of fashion. So when we liposuction, generally we draw these like topographical areas where we know that this is the thickest area and it thins out there. And when we use these cannulas, we hide these incisions somewhere they're not so visible. When we use these tubes to suction fat more here, a little bit less, a little bit less, a little bit less. So we make concentric circles so that we can flatten these high areas. So with fat freezing, we do something a little bit different. So we test for pinchable fat. So the key about these fat freezing or even the radiofrequency fat reduction devices is that we want to treat pinchable fat. There's other reasons why the silhouette changes, such as loss of abdominal tone and so forth, which we need to address, hernias and so on. But when we're treating the fat, we need to be able to pinch it. If we can pinch it, we can reduce it. And that's the same for liposuction, as well as these fat freezing or radiofrequency heating type devices, or even the ultrasonic cavitation. So here essentially is a suction cup, and then there's a tubing, and it sucks similarly this pinchable wedge into the cup where it delivers cold, and that chills the fat to a certain temperature, and we maintain that temperature over a specific time, and this has been shown to actually turn off the fat cells, and they die selectively. This happens over several weeks, so you don't see the immediate change, but over about 3 to 6 weeks you slowly see that pinch fat thickness can be reduced between 15 and 20% of thickness with each session, and these can be laid on one session after another, so you can get serial
after
sequential
6 weeks.
Yes, after 6 weeks. Well, you do want to see how much change there is, and then you reassess it and see if there's still potential for further change, and then you might reapply the technology one more time or a third time. Sometimes, obviously, if we see patients and we're experienced, we can roughly give a guide to the patient how many sessions that would be, and that way we can plan it over several months. But even for thinner patients, we do the first treatment, we reassess them at 6 weeks and see if they would benefit from another treatment like this. So there are some areas where perhaps it's not so good at, and that's where you don't have a cup of the right size, or the skin thickness is just too thin, and the pinch thickness is too thin to really be effectively sucked into the cup.
So which areas are typically very effective for fat freezing? What would you...
Certainly the truncal areas are very suitable, and they are areas that we do the most often. So that would be around the front of the abdomen, occasionally up here below the ribs, the truncal areas, the love handles, which we actually do on the side like that, the love handle areas. The saddlebags, we do have special cups for those, and the inner thighs, where there's excessive amounts of fat there, and we occasionally can use smaller cups for like the inner thigh, the inside of the knees, and we also have a smaller cup for the chin areas, so where there's a lot of...
Okay, so you've had your session. And you've had the cold. What happens after that, after you've come out of your session, and you said it takes 3 to 6 weeks to see any results? What can people expect in terms of downtime or experiences after they've had their session?
Okay, so primarily where I see the non-surgical techniques really being very popular is that it doesn't really interfere in your lifestyle. So it's something that it takes an hour to do per cycle. So for each area that we're treating, it does take an hour, but it's an hour that is relatively comfortable. You could be doing something else on your computer, watching a movie or something. It's not as involved as, say, having a surgical procedure. No
anesthetic. There's nothing
no
like
anesthetic required. There's no anesthetic required. No injectables. No topical anesthetic required. The cold actually does a lot of the work. So during the first minute where the fat is being sucked into the cup, there is a pulling sensation on the skin, which can be a little bit uncomfortable. But then the cold sets in, and literally like after a minute has passed, the skin becomes numb and you don't really feel that pulling sensation after that. And actually that area that we're treating becomes numb, and you just wait for the cycle to complete. So it's relatively comfortable, you can be doing something else. At the end of the procedure, the suction is released and then the cup's removed, and the skin will feel, that area that we've treated will feel a little tender. And that is typical. So when we press on it, it's a little tender. We do massage out the area. It will be a little swollen as well. Like, there's a little bit of inflammation, which is again expected. But we massage out that area to make it comfortable. The patient then change. She can go back to work. They can even go back and have a workout. That's perfectly fine. If they feel that that area is very sensitive, sometimes we recommend the use of a pressure garment or some kind of compression garment, just so that the skin isn't really jiggly when they're moving around, when they're exercising, when they're going about their daily activity.
Okay, so I actually tried this treatment.
Yes, and how did you feel?
And I was very pleasantly surprised by how easy it was. During the session, I didn't feel any cold. Yes, I agree with you, the sensation when the cup is applied, just for that first less than a minute, I would say, just that immediate attachment to the body. But after that, you don't feel like anything at all, and I was happily scrolling and working away on my phone. So yes, you could just be sitting there doing anything else for that hour. In terms of downtime, I didn't need any kind of compression or any special garments or downtime. I didn't exercise for 1 or 2 days after that. And there was perhaps a slight sensation of numbness in those areas for maybe a week or 10 days, but very, very, very faint.
Yes.
You can just feel something.
So the skin will feel a little numb, and that's similar, for example, if you've been exposed to the cold for a while.
Yes.
But it does recover.
Yes.
And typically we tell patients about a week,
exactly.
The skin sensation should come back to normal. It is expected. There's nothing permanent about it. And is that similar to what you experienced?
Yes, absolutely.
Okay. What about the tenderness? There was a little bit of tenderness in the treated areas?
No tenderness for me, no. And I was keenly looking at the results and how quickly I would see any change.
Yes.
I think after 2 or 3 weeks I did start to notice a change in the shape, and definitely after 5 or 6 weeks I felt a big difference just in the shape of the body that I knew. It felt different to me.
That's
so
excellent.
I did the love handles and the saddlebags especially. I was actually very surprised.
Yes, you did the love handles and you did the saddlebags.
Yeah.
Right, and then you can notice it in your clothes as well, right?
Yes.
That's ultimately the end point is you should look better in your clothes and you should feel better about your body shape.
The appearance. So I have a question in terms of what's going on inside. How safe is it for your body? Because the procedure itself isn't invasive, it's very comfortable, you sit there, but what's actually going on inside?
Well, with the non-surgical treatments, we know that they are safe, whether you use radio frequency heat beyond a certain temperature for a certain time to break down those cells, or you chill them below a certain temperature for a certain time. They turn on certain apoptosis or cell death type mechanism, so that the cells do die off. When these cells are broken up, they're broken up, they're removed by the body through natural processes. It's not traumatic in the sense it doesn't sort of rupture the fat cells and increase your fatty acids in your body or your cholesterol levels or anything like that. So it doesn't, there's no evidence to say that it will affect you in a negative way or the contents of your blood metrics. So it is very, very safe in that respect. As far as contour irregularities are concerned, which is a very, very much a reality with liposuction. So if you over lipo a certain area and after the inflammation settles down, then sometimes there's irregularities or a divot or a hollow area that might need touch up. So we need to graft back fat and so on.
Right.
In my experience, we don't see that so much or at all with the fat freezing technologies, largely because they are small incremental improvements. So if you reduce that area by 20%, and the idea is to keep improving it by 20%, and often we would apply the applicators in an overlapping fashion. So we wouldn't put it on the same area twice. We would overlap it slightly, and that can get a little blending effect in the edges. We don't see any cut-offs or ridges or contour irregularities with when we do it. But I think clear planning is quite important, and I think my experience in liposuction has shaped the way that I place the applicators and I plan them. And certainly the machine operators might have the vendors might have their own approaches to it, but I use the technology based on the way I see sculpting.
Yes, and I can testify to that actually, because I wouldn't have said that I needed anything on my love handles, but I took your suggestion, and I do feel that it has made a big difference to the silhouette and the overall sculpting, as you say. You know, all the body parts are, you know, interconnected, obviously.
So there is something very emotive about the way that one views the body.
Yeah.
And it's sometimes it's difficult to just break it down into its parts, but we know, with a smaller waist and less love handles, for example, then it makes the torso look visibly longer, and it makes you look taller. So the proportions fall into place, and that's really what makes the silhouette more attractive. Whereas when we put with age, if we put on a lot of weight around the hips and love handles, the waist looks higher, the pelvis looks heavier. There is a little bit more of like a tired sort of appearance about the body. Right.
So my final question for you, in terms of expectation, if somebody comes to you and says, I want to get rid of my love handles, I want to get rid of my saddlebags, I want, a fluid shape, how can you manage people's expectations in terms of the levels of success?
Well, I generally will spend some time talking about the differences between doing a surgical procedure versus doing non-surgical procedure. And I will also, one of my philosophies actually is that if you want a nice shape, you need to get to the root of the problem. And as my practice has evolved, I've realized it's not simply fat alone, that our body does change with age, and that we have to address core muscle tone, which is often, there's laxity due to inactivity, but also with age and maybe post-pregnancy when all those muscles are stretched out, and those have to be restored in order to get this tight silhouette again. The obliques need to be improved, the abdominis needs to be improved. So muscle tone, the pinchable fat has to be addressed, and the quality of the skin has to be addressed.
Right.
And then posture has to be addressed. And so these 3 or 4 building blocks help to build a nicer silhouette. Okay. Liposuction can address some of those, including when we have liposuction, we also had some energy-based devices which we would use together with that, like laser liposuction or ultrasound vaso liposuction, which can also help to tighten tissues and tighten the skin after removal of the fat. Similarly, with non-surgical approaches, I now recommend also muscle tightening. Regular exercise is very important.
Right. It's not a cure-all for everything.
No, it's not a cure-all for everything. I think it's really, it would dovetail really well into somebody who's committed to a healthier lifestyle and wanting to look and feel better about themselves. So get a good consultation is most important. Have those differences explained to you. Remember that with non-surgical approaches, it's slow and easy, multiple incremental improvements each time. You might have to combine a couple of different machines to tighten the muscles, reduce the fat, and then also to smoothen the surface skin, which might be loose.
Yes, to get the overall effect that you want.
To get the overall effect you want.
We have a question from our wise tribe. Can this be done in slightly saggy arms? For the hips, after one session, how many centimeters should we expect to lose after 1 month?
That's 2 questions.
2 questions from one person.
Saggy arms are, again, quite typical with age. They seem to affect women more than men.
Yeah.
And again, I would get the patient in and assess. Like, some of that is fat, some of that is loose skin.
Muscle tone
and loss of muscle tone.
Yeah.
But also loose skin.
Yes.
So again, after an assessment, I would make a recommendation, and it might be a combination of some skin tightening together with non-surgical. So this is the arms, and sorry, my drawing is terrible, but the saggy bit, some of that might be fat, and then we might have to tighten some of that skin, and that can be done non-surgically or with a liposuction procedure. And I've seen good results with both, and so non-surgical treatments can be effective, but I think where the disappointment comes is that if we don't explain it to the patient properly. So some skin tightening is often necessary to augment the reduction of the fat as well. Then you get a nice taut arms. And of course, if they're willing to work out and you can get better definition in the shoulders, the biceps, and the triceps, then you get even nicer toned-looking arms.
And what about the hips? A month's worth of sort of treatment. How many centimeters?
So with the hips, if we're talking about essentially the love handles or the pinchable areas above the bony hips.
Yes.
With this area, generally not a lot of skin laxity. The skin laxity tends always to be in the looser areas in the front of the abdomen. So here I just use fat freezing, and you would do it 1 session and wait 6 weeks and reassess it. And within that 6 weeks, as I was saying, as a guide, reduction in the pinch fat thickness of about 20%. So if you're a thinner person, one treatment might be all you need to really improve that silhouette. If you're a little bit heavier, we might do 2 or 3 sessions staged over 6-week intervals. Yeah. 6-week intervals, yeah. Wait for it to settle and then repeat it again.
Yeah, that makes sense. Everybody's different shapes and sizes.
Absolutely.
So I think that's all we've got time for today. Thank you so much for
You're very welcome. I hope that was useful to everybody.
Definitely. And we've got a trial offer if anybody would like to try a session of the fat freezing here at Aesthetic Studio. They're very kindly offering a trial session at $188. All the details are going to be in the post, so please have a look and ask any questions that you like. We'll be online for a while to answer anything that you have to ask. Thanks for joining us today, and we'll see you next time.